putting us leaps and bounds closer to identifying Alzheimer's in patients 10 to 20 years before symptoms even start. Harvard neurogeneticist Dr. Rudy Tanzi is here to help us understand what this means for all of us. Dr. Tanzi, what does this blood test actually look for?
Well, this new blood test is truly a major breakthrough. It's no small thing because it's able to detect pathology in the brain and specifically Alzheimer's. Because you have to realize when the pathology that causes Alzheimer's in the brain can cause other forms of dementia. And this blood test says that there's amyloid plaque forming in the brain and it's causing this other pathology called tangles, which kill the nerve cells. And it's specific for the amyloid-induced form of dementia where you get the tangles. And so that means two things. One is that we can differentiate Alzheimer's from the other dementias. Second, it validates something that we talked about on this show in the past for the first time, because there was controversy. Does the amyloid plaque cause the tangles to kill the nerve cells? And we showed that this happened in our little brain organoids in the dish that we make to recapitulate Alzheimer's. Now this is the human proof of concept. And here's a test that says amyloid's in the brain and it's causing tangles and it's initiating this disease decades, up to 2 decades before we even have symptoms. So you can know in advance when you're starting the disease.
Now that's, by the way, analogous to what we do, for example, in the heart, right? We track your cholesterol to stave off heart disease decades in the future. Or we track your blood sugar, right? So you're going to make sure you avoid contracting diabetes and the consequences of that. So this blood test could help detect Alzheimer's decades before you experience memory loss so we can do something about it, which means you get ahead of it with the right interventions. So let me show you why Dr. Tanzi thinks this is so important to attack the disease early on, right? So he argues that the formation of amyloid plaque, as just pointed out, is like lighting a match. So, boom, the match is on there, all right? Now, it's the precursor to what becomes full-blown Alzheimer's, which is like this forest fire behind me, right? If I got a forest fire raging back there, right, and I've got a drug that on the market, which is what they currently do, that essentially blows out this match, does it put out the fire behind me? It's too late, right? In an attempt to extinguish the forest fire, we blow out a match. It's not going to do anything to really show clinical benefit. The symptoms are too far gone. Right? That would be like me trying to give you a statin when you're lying in my operating room and with me taking a bandsaw to open up your chest because you're having a heart attack. It's too late. So this blood test allows us to blow out the match before the forest catches on fire. Dr. Tanzi, when will this blood test, really important test, become available widely and who should take it?
So the idea would be in the future, you take this test at middle age. If it says, yeah, the match has been lit because the brush fire is going, then we want to use drugs to stop that early on. There are drugs in development that use antibodies. We're developing a drug with colleagues in San Diego. There will be a little white pill that stops the amyloid, the way you take a statin to stop your cholesterol. And that's how we're going to do early detection, early intervention to stop the disease in everyone in the future. But right now, the patients who are suffering, we need to do more. We need to help put out the fire, help protect you against the fire. And that's where I'm working with 2 different companies to achieve that goal.
Well, Rudy, as you know, my mom has Alzheimer's, diagnosed last year. Am I the perfect person to get this test now so I know if I'm actually going to develop the same problem she's experiencing?
Well, if you have a family history, you want to be even more vigilant, more diligent about getting that test early on. So, yes, you would be a candidate to get this test more urgently than others because of family history.
So I also want to applaud you because I was reading all the papers that you had just been involved in a trial that showed benefit. So, can you explain it for the first time to our audience?
Yeah, this is really exciting. So, we want to help patients with Alzheimer's or Lou Gehrig's disease or Parkinson's disease. It's always the same thing to help a patient not put out the fire, because that fire starts in all these diseases. You have to stop the neuroinflammation. So I'm involved with 2 companies. One company, Amylyx, that I helped start with 2 very young guys when they were still undergraduates at Brown University, came up with a drug combination that protects the nerve cells against neuroinflammation. And that drug combination was just used in an ALS trial, Lou Gehrig's disease, and was successful. The paper was just published in the New England Journal of Medicine, a company seeking approval. And at the same time, they're doing an Alzheimer's trial to see if it works there. And then another company I'm working with, called AZ Therapies, is developing a drug that will actually put out the fire. And that drug is currently currently an Alzheimer's trials, phase 3 trial, and we're hoping to get those results on the Alzheimer's trials by the end of the year. So this could be a really huge year for Alzheimer's and neurodegenerative disease.
Finally, something good about 2020. I knew there had to be something good happening.
Exactly. Let's just hope that we get with a band. Good man.
Dr. Casey, thank you very much, Godspeed.